everyone, my name is Jill. I'm a 48-year-old mom of 2 kids. This is my daughter Olivia and my son Colby. I'm a busy mom and I work as a vascular technologist. I am lucky enough to work side by side with Dr. Mary Constantino, who is an incredible interventional radiologist and global speaker. Here is my uterine fibroid that I need to have embolized, and I'm pleased to share with you my journey and my experience in having an embolization.
Welcome to the cath lab. Different perspective. Okay, Jill, how are you feeling?
I feel relaxed and confident, and I'm in the best of care.
Aw, so nice. Feels different down there, huh?
It does. It is a different perspective.
From somebody standing over you like this, isn't that an intimidating place for a patient? Yeah. And there's her arm board. Okay.
But I am ready.
So we got access. Single stick, so far going well. Smooth as butter. Here's a cocktail going in with heparin, verapamil, and nitroglycerin. And sting the hand, so just opening up the vessel. Can you feel it, Jill?
It's a mild stinging, but it's going down.
Do you have any issues right now? Feeling anything weird?
No.
So everything's going great. We do this nice and slow.
So the access was so slick, and then the sedation, Nikki, is so good.
What did you give her, Nikki?
Given her some Benadryl, 25 milligrams, and then I gave her 1 of Versed and 50 of fentanyl.
So there was just a little warm. What is that?
A little warmth is probably just the vessels of the hand dilating.
Okay.
So the other thing we do here is I have a warm saline bucket. This is Isaac's genius. I try to make things kind of warm and smooth as they go through this vessel to prevent spasm. So I make sure our glide is well hydrated and warm, because it just doesn't make any sense to put cold saline into an arm. So we're already down in the abdomen, Jill, as you can see.
Yep.
And Isaac's going to move the II. Always important to watch the tip of this wire. Today is a good day because we're going on the right, and my template dictation starts with it on its right, but everybody else goes to the left. It means I have to change my template. Thank you. Okay, so that's the external.
So I know that we don't have nerve endings, but it is odd. I don't feel a thing.
You don't feel pain? You don't feel warmth in your pelvis with the injection? Okay.
Sometimes you feel like you have to pee,
Yeah, you really
or like you're
should.
going to wet yourself, but you don't. It's just the warmth of the dye.
A lot of people get real funny with that. I think because you're nice and relaxed, and that makes all the difference in this procedure. Go ahead. And a little Valium beforehand never helps, but I'm gonna do a little run here because there it is. So usually you just pull back the catheter, and the catheter pops, and you can tell you're the internal. But people who are thin, you can spend some time trying to get into that. And with radial access, you can't have a lot of pushes back and forth, I think. You just don't get the opportunity to move the catheter quite as much. Okay, now I'm going to do a run, and then we'll have you stay real still. I'm going to use it as a roadmap. And we're going to pull the dye here in a second. Oh, yeah. Pretty much. I'll take the microwave. Stay real still for me. Shake this.
Throughout this procedure, I felt totally relaxed. I didn't experience any pain. In fact, I actually fell asleep. And I did really enjoy listening to Dr. Constantino work and her explanation of her steps. And my procedure is probably almost over. It was amazing how fast and efficient the team worked. Super grateful for their expertise and incredible care during my procedure.
So we're already in the right uterine artery. 2.5 minutes of flow time, wire out. Which is so great. Now we're going to go to, a anterior posterior position and do a run. Always confirm. I'm going to want to advance this just a little more heavily.
You want to shoot and see how far?
We'll just for refluxing purposes, it's better to be around the first loop. Sometimes the microcatheter gets too many twists. I feel like the embolic doesn't go through it quite as well. That's just beautiful. Okay, we'll take 5 to 7.
Lifespan. Make sure bubbles are all out. Wait for it to settle a bit.
Oh, little embolic. A moment of UAE.
You see it on the screen?
Let's see on the screen. I always fluoro when I'm doing this, unless it's a hugely huge. And the downside is a little bit more radiation, but as you can see, we're still 3.2 minutes, and we'll probably be under 5 minutes for this side. But you never know how fast things are going to stop, and you never want reflux. Feeling anything?
Nothing. Surprisingly. Sleeping.
Like a Disney princess that you are, just asleep in this picture perfect. Debate about intraarterial lidocaine and the pain management techniques. So I used to do nerve blocks. I don't do those anymore. I actually really like lidocaine.
And thank you for that lidocaine. I experienced no pain the day of the procedure. I did have some discomfort the day after the procedure, but my pain was well managed by the team at AVC. I can't thank Dr. Constantino enough for her tremendous skill, her dedication, and passion to her patients. I really felt like I was in the best of hands. In fact, I know I was.